I'm Dr. Vamsi Krishna. I'm working as a consultant pediatrician here. I've joined this organization in this hospital from 4th of July in 2011, and since more than 2 years I've been working here, and I'm still continuing my job here. And it has been a great experience working in this wonderful organization. I've been tremendously impressed with the work the organization is doing for the poor people. And before I joined, because I belong to my native place is Anantapur. So I wanted to work here mainly because initially to gain some clinical experience. But once I started my work here, and I was really impressed with the service the hospital is doing for the poor people. So later on, I've continued my job here, and it has been quite a long journey here, and I'm really grateful to work with this organization. Since my childhood, I always wanted to become a doctor, and on top of it, my uncle is a pediatrician, and I also like children very much, so I've decided to become a doctor who takes care of sick children and make them happy. My main work here is to work in the NICU, that is a neonatal intensive care unit, along with the pediatric wards. Neonatal intensive care unit is an unit where we treat many of the sick newborn babies which are delivered here, and even we do get a lot of referrals from other hospitals where they don't have the facilities. Their babies will be coming here mainly for the treatment. Apart from this, I also work in the pediatric wards and the OPD, and I also look after the emergencies that come to the pediatric casualty. The common conditions what we do see in this hospital is mainly a lot of infections like malaria, typhoid fever, and dengue fevers, lung infections. And coming to the ICU, we see babies who have infections immediately at birth, and some breathing difficulties, babies with heart problems. So these are all the common causes what we see here. Some children with seizures, that is convulsions, and we do give multidisciplinary treatment here for majority of the illnesses, and we also receive many of the children from other hospitals in many parts, in the surrounding parts, small towns where they don't have adequate facilities, so they refer here for a better management and treatment here. Early detection is one of the important things the health workers at the grassroots level they have to focus on, along with the health education, and to tell the many of the people are illiterate, so they don't know whether the child is really sick or so if you educate them that some of the common things, common diseases, the symptoms of it, by which the parents can know something is wrong with the child, they can come to the hospital much earlier. If they come at the later stages, it might be difficult even for a well-established hospital like us to treat everything. If they come at an earlier stage by knowing the symptoms much earlier, the illness can be cut short at that point of time, and the complications can be really prevented. As far as I know, because I've started my work in the past 2 years, I've seen a tremendous improvement in the awareness of the people mainly, because one thing is in the past, many of the women, they used to deliver at home. They don't even know that they can come to the hospital for regular checkups and deliveries. But since maybe one and a half year, I can say that the hospital deliveries have improved, and along with that, the maternal health and the child health has definitely become better. And another important thing which I want to mention is previously malnutrition was very rampant in this area, and with some of the health education activities that are being conducted by the RDT in many of the rural villages and the surrounding places of Anantapur, the nutrition aspects have definitely become better, and with that the children are becoming more healthier. Altogether, we have the key to change everything.